Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, Health Secretary Ted Herbosa's plan to hire nurses who didn't pass the board exams draws mixed reactions. President Bongbong Marcos urges local government units to reach out to the vulnerable sector to get their bivalent shots. Health Secretary Ted Herbosa joins us in the program. And later, the Makabayan bloc seeks to investigate the complaints against Cebu Pacific. Gabriela Representative Arlene Brosas tells us more in the program. The Health Department is granting temporary licenses to nurses who did not pass the board exams yet but reached a certain score. Some nurses expressed support while others are against it. It also drew negative reactions from lawmakers. Catherine Cruz reports.
Health Secretary Ted Herbosa is proposing to give temporary license to nurses who failed the board exam but scored 70 to 74%. This is to fill some 4,000 vacant nursing positions in the country. Nurses have opposing views on the matter.
Pabor naman po ako na bigyan sila ng temporary license. Sa nursing kasi may mga delegation, especially kapag mga temporary license yan, hindi naman agad-agad ibibigay yung mga patient na may critical na mag-handle sila.
Hindi po ako sang-ayon. Kasi unang-una, board exam, doon kasi andun yung standard eh. So, kailangan mo munang mapasa yun para malaman na meron ka talagang alam sa pag-aalaga ng pasyente. Hindi mo naman pwedeng ibaba yung standard para lang ma-augment yung staffing sa mga ospital.
Alan, who's also a nurse, says increasing their salary is a must so they don't have to seek greener pastures abroad. He says this will also help address the lack of healthcare workers in the country.
Magdagdag sila ng mga iba pang benepisyo para ang mga nurses natin, lalo na yung mga marami tayong kasamahang nurses na talaga naman pumasa sa board na mga nasa ibang field sila ngayon.
Some patients at the hospital in Quezon City say they have no problem with nurses holding temporary license giving them medical attention.
Okay lang ma'am kasi nga 'di ba karamihan na nakakapasa ng board pupunta ng abroad. Kasi doon mas malaki ang sweldo nila. Kaya okay lang kasi kapag naka-graduate naman sila, yun lang, hindi nakapasa ng board.
Pwede naman po siguro kung hindi naman po makakasama sa amin. Pwede naman po siguro. Pero mas maganda pa rin yung mga lisensyado.
However, Senator Coco Pimentel is not in favor of Secretary Herbosa's proposal, saying it might diminish the integrity of licensure exams.
I think it's best that our examiners or the people who are designing these tests should revisit the exam and then make sure that the test is direct to the point. It should really test competency and then the readiness to really act and serve as a nurse.
Nonetheless, Pimentel points out that it's understandable that such issues are being deliberated by government agencies amid serious nursing shortage in the country. Catherine Cruz, CNN Philippines.
In other news, workers and employers sit down to talk about the proposed wage hike at the National Capital Region Wage Board public hearing. Workers say they need a salary increase to survive. But business insists they also have to recover from the impact of the pandemic. Paige Javier tells us more.
Basic needs versus business recovery. These were the clashing interests raised by labor groups and employers at the NCR Regional Wage Board hearing on petitions for a wage hike. 3 petitions for a salary increase were tackled on Wednesday. Kapatiran is asking for a 100 peso hike.
Naiwanan na ang sweldo ng mga gawa ng cost of living, hindi pumantay sa produktibidad ng manggagawa ang taas na sweldo.
2 other labor coalitions want the minimum wage in Metro Manila raised to over 1,000 pesos. The current minimum wage in the National Capital Region is 570 pesos. The last increase, 33 pesos, was in June last year.
Nararapat lamang na dinggin na ang panawagan ng mga manggagawa para sa dagdag sahod dahil sa matinding pagtaas ng mga presyo ng mga bilihin.
Still reeling from the pandemic, the private sector says it cannot yet afford another wage hike. The Employers Confederation of the Philippines warns small businesses will be most affected by a new increase.
As in the past wage orders, may mga exemptions naman kami, may mga safety nets for those who cannot afford the increase.
The wage board will deliberate next week to decide if there should be an increase and by how much. Before the hearing, labor groups ate kangkong, tofu, and rice, a symbol of what their wages can afford. They're appealing to the president to put them first before the food on their plates completely disappears. Paige Javier, CNN Philippines.
And let's go back to our top story. Nurses are divided on whether board-eligible nursing graduates should be given temporary licenses. Let's go straight to the source of the story. We have Health Secretary Ted Herbosa. Secretary, it's good to finally have you. Welcome to the source.
Yes, good morning, Pinky. Thank you very much for having me.
Sir, congratulations.
Sorry for
Opo.
being unable to answer the previous calls. My phone call has been crazy since I was appointed.
I know, and you've also been everywhere. Sir, first I want to talk about this, your proposal, which it's gathered some reactions, both good and bad, ano po?
Yes.
And there's a lot of people probably still on the fence. But first of all, because of what you've heard so far, apart from the stuff that you have to do, is this something you still are thinking of pursuing to allow the 70 to 74% who got a grade in their nursing board exam to still get temporary licenses? Are you still taking this track?
Well, thank you very much for asking this question. It's been a monkey wrench that I threw to the problem, and everybody's ganging up on it. And I like that. And I met with the nurses yesterday, the Philippine Nurses Association and several nursing groups, and they were actually agreeing with my ideas. In fact, we agreed on some things to do as our next steps forward. And we'll announce that soon, but I'll keep that under wraps. But we've had an agreement with the nurses, and they are actually happy with the way I've been handling this problem. Of course, many people don't understand what I presented as an out-of-the-box solution. I'm a professor, no? I teach and we do tests. We evaluate students. That's my forte. You cannot judge a nurse who finished 4 years of college with one singular test. Sometimes that one singular test is not a very strong assessment of who they are and what they can do. So this is important point of view because I'm an educator as well as a doctor. And many people are, riding on this issue with little knowledge of how assessments are done and why this proposal is being put forth in the table. I'm not changing the assessment model. I'm not changing the way nurses are evaluated and given license. I'm only trying to fix a problem of lack of nurses in the government hospitals. That means lack of nurses means lack of services. Now, would you rather have lack of services?
Lack of nurses, wala pong kama kung walang nurse. I've been hearing your interviews. Opo.
In fact, most of the hospitals want to increase their capacity, but they can't because we don't have the appropriate number of nurses. One hospital bed requires a minimum of 4 nurses to function 24/7, 24 hours a day and 7 days a week for one single patient. So that's been the problem. Before, that was not an issue. Most government hospitals would have a queue of nurses wanting to apply. Now, since the outward migration of the other countries building their health systems after the COVID crisis, they saw what the problem was. They started building their own systems, and their biggest solution for human resource are Filipino nurses, which are the best nurses in the world. So instead of creating, they create solutions, but the unintended consequence is it creates problem in us, a middle-income country that cannot pay the salary of a first-world country. So I'm trying to solve that with out-of-the-box solution and say, hey, in shortage, I'm going to get a 70 to 74 rating because that's probably 1 or 2 questions they didn't answer right in a single exam.
Yeah.
Right?
I was hearing some of your reasons for this. There's a shortage, there's 4,500 vacancies or plantilla, 70 to 74%. Parang ano naman ho sila, they will still be under the supervision of a nurse because it's a team of doctors. I heard all that, and it's good that we're repeating it, sir, for those who might not have heard it. But let me bring up some of the concerns. No, Senator Pimentel was saying, no, because this might affect the nursing exam or integrity, sir. Yung sinasabi niyang of the testing system. Para po sa kanya, 75, pasa ka. Pag 74.5, plain and simple, you did not pass. What do you say to that?
Actually, well, I have to explain probably to the senator sometime. Maybe I should visit him and explain the methodologies for tools or assessment. When you do an assessment for something, this one is for standards. You do not move. I am not proposing a move of the passing rate. It is the same. It's 75. I am helping the people who didn't make 75. You understand? So by making them work as nurses or
Yes, of
assistant
course.
nurses, their chances to pass is higher. Why did I limit to the 70 to 74? Because they're the ones I know if we train them, we mentor them, we give them money for review classes, they'll probably pass it in the next round of
Actually,
attempt, the next attempt.
you said they're gonna ace it. Yun po yung inyong
That's
sinabi.
right. They're gonna ace it. But if they work, you deny them the employment, and they work in a BPO industry, in a aviation industry, in sales of medicines, they're never gonna pass the nursing board again.
But that's exactly what Senator Pimentel was saying. Sabi niya, I talked about this. I talked with him about this at length, sir. Sabi niya, hindi. And he's also not saying ibinababa yung passing grade ng 75. Sabi niya, this, sir, I don't know if you'll be open to this. Stick to the 75% passing grade. He says, why not look into the exam? Yung mismong board exam that the nurses take, possibly simplify it more so that there will be more passers. And he adds that meron naman daw nursing board exams in November. Why not do this then? Are you open to that?
That's not my job. The job of evaluating the board exams is the nursing board of the Philippine Professional Regulations Commission. So my proposal, my problem, and the solution I'm trying to look for is not the passing rate. My problem and the solution I'm trying to look for are services. I'm in charge of the hospitals. I cannot give services to the people if I don't have nurses. Now, if I don't have the qualified nurses and the licensed nurses, I'm going to search the bottom of the barrel and look for people that can provide a similar service with safety and quality. So this is the out-of-the-box solution I've thrown. I'm very happy that the media has caught this on. Other people have caught the discussion. Because that's what we do in the academic world. We throw in an idea and people get the discussion. What will we do? It depends on what agreements will happen between the PRC and the Civil Service Commission.
Correct.
In fact, the DOH is outside this. The DOH only regulates hospitals. We don't regulate professional service. So actually, when I threw the monkey wrench on the table, the ones that should act is either PRC or the commission on the Civil Service Commission.
Yes, but
they should start thinking about this as out-of-the-box solution.
But Secretary, you're already talking to them, di ho ba? You're already talking
and they're all agreeable to my idea. But they should also listen to Senator Pimentel and all the negative input because I'm listening. I'm looking at social media. There are things I'm hearing like, which are valid. Number one, they said, wouldn't that create discrimination and then you're going to give the salary to a board certified and a board eligible
versus hindi pumasa.
Baka magkaingitan sa workplace.
What do you think of
I'm
that?
listening at these things, and of course, it's an idea. It's a developing idea. So we will, improve it some more. And it's not just for implementation. It's just a discussion. As of now, it's just a discussion and debate. And out of discussion and debate, I do hope we come up with a tangible solution for the nursing crisis in the Philippines, in the public hospitals, and in the private hospitals as well.
So yun nga po yung sinabi niya. Kasi he was not comfortable with this being retroactive. Retroactive, Secretary, in a sense that bibigyan ng temporary license yung 70 to 74. Kaya sabi niya, why not talk, do another, modify possibly the exam in November so that it could have simpler, I don't know sir, parang simpler questions para mas marami pong makapasa. Ayaw niya, I guess he was very concerned about the retroactivity of this proposal.
There is no retroactivity. I have not talked about retroactivity. In fact, it's a proactive solution. The solution I'm offering is I'm going to take those that barely passed, those that nearly passed, but because their experience wasn't good enough, didn't make the 75. I'm going to take them, mentor them, and make them pass. And if they pass,
Yeah.
and then I will offer them actual jobs in government to serve the people. So there
which-
is no conflict between Coco Pimentel's solutions and my solutions. She's looking at test integrity and validity of exams. I know that. That's something we do in the academe. But I'm talking about a different thing. I'm talking about services in public hospitals.
Yeah.
So magkaiba siya. But they actually are unified. So I don't even want to lower the standard because as a doctor, when I take care of patients and I do doctor's orders, I want my nurses to carry out the orders correctly so that there are no mistakes and there are no errors and my patients don't get into trouble. But that's another discussion. The discussion and the problem, and I'll state it again, there are 4,500 vacant plantilla items in DOH alone. Pinky, DOH. Yesterday, I was talking to a mayor of Cabuyao. They have a 100-bed hospital and they cannot open 100 beds because they're only good for 50 beds. Why? They don't have nurses.
Quickly,
so
Secretary.
If you multiply the problem, the DOH hospitals, 72 of them all over the country, at the LGU hospital, and I'm hearing the same from the private sector. So some private
the problem with the
hospitals are
private
not opening a
sector,
whole wing.
Secretary, mas mababa pa po yung sweldo ng mga nurse.
Exactly. That's the other discussion we need to take on, but that's a later problem. I want but some of the private sector have now reached near the salaries of the government. Because the government starts out with 35. I'm hearing private hospitals now giving 25 to 30,000 to their nurses. So they're approaching the competition, which is the public hospitals. So I think if we fix this well, we need to actually be able to solve this problem.
So
what I'm saying is there is a problem. It is a global problem, but we can solve it with internal solutions.
So in essence, Secretary, to end this topic is that you're still pursuing this, but you're open to any more possible proposals or suggestions.
Of course. And any solution needs, you always improve it. And when we implement it, it's not going to be a permanent one, Pinky. It's only until I fill up. If I fill up the position, then my services expand. Boom, we're back to what Coco Pimentel wants. Grade of 75, you can't work in government. So it's a temporary Band-Aid solution to a crisis that can actually become bigger.
All right.
As the other countries import our nurses.
I know that you have to go, sir, because you still have something else. I wanted to talk about the bivalent vaccines. Maybe another time because you were injected with a bivalent vaccine yesterday.
Yeah,
maybe
I
just
have it
quickly,
now,
sir, how are you? Because tumaas ho yung blood pressure ninyo.
So tell the people, don't worry, because in my previous injections, the first and second and the booster doses, my BP always goes up after the injection. So that's an expected,
That's normal for you.
And then last night I felt fever and I knew the vaccine kicked in because when that happens, you know that the vaccine is actually triggering your immune system. So I know I got because last night I had to take paracetamol because I was feverish at night. But I'm okay now. I'm good. I'm working. I'm at the office, ready to handle the job for today.
I hope to speak to you again another time. I know you're busy today. Secretary Ted Herbosa, sir, thank you so much for your time.
Thank you, and I'll be there personally when you invite me again.
Thank you,
Thank you very much, Pinky. Yes.
And we'll be taking a short break. This is The Source on CNN Philippines. Please stay tuned.